Hi, I'm Dr. Joy Lucas. I'm a board certified pediatric pulmonologist or lung specialist for kids. I help kids and their families successfully treat asthma symptoms. And today I'm going to share with you 5 tips for asthma success. So let's get started. Tip number 1. Avoid asthma triggers. Triggers are things that cause asthma symptoms, and they can be different for everybody. Triggers can be mold, dust, pollen, or allergies. So if you think your child has allergy symptoms, make sure that you get them allergy tested, and the test is specific for your region. If you suspect they are sensitive to strong odors like bleach or perfume, avoid those. Avoidance is going to be the major way that we prevent triggers from causing worsened asthma symptoms. Tip number 2, use a spacer device. A spacer is a device that attaches to your asthma inhaler and allows it to effectively deliver asthma medicines to your airway. Believe it or not, without a spacer device, 50 to 80% of the asthma medicine you take is swallowed and never makes it to the lungs. So make sure if you're given a spacer device, you use it with your asthma inhalers. Tip number 3, use albuterol before you exercise. Albuterol is the rescue medicine. It works in 5 to 15 minutes to loosen the muscle that wraps around the airway. And so it allows you to exercise more comfortably if you have exercise-induced asthma. Keep in mind, if you're exercising outside in the cold air, that can be a trigger for your asthma symptoms. You want to make sure if you're exercising outside during the winter, you warm up first and you breathe in through your nose and out through your mouth. The nose warms and filters the air. Make sure that you take your albuterol inhaler in enough time for it to work if you're exercising. So remember, albuterol works in 5 to 15 minutes and lasts for 4 hours. Tip number 4, don't smoke or vape around your kids. If you're a smoker or you vape, you want to make sure that you do so outside. Smoking and vaping are a cause of asthma symptoms that are difficult to control in kids. Smoking and vaping are also hazardous for your health. So try to quit. But if you can't quit, smoke outside, vape outside, change your shirt, wash your face after you smoke, and try to wear a smoking jacket so that the smoke and vape doesn't end up on your clothing. Tip number 5, make sure you take your asthma medicines consistently. If you've been prescribed daily medicine for asthma twice a day, you need to take it 80% of the time for it to work effectively. That means you're taking your asthma medicines 11 out of 14 times in a week. Your asthma medicines only work if you take them. I hope these tips were helpful to you and they are going to help you treat your asthma successfully. I'm Dr. Joy, MD. I'm a board certified pediatric pulmonologist or lung specialist for kids. I help kids and their families successfully treat asthma symptoms. I have a product coming out just for you. It's called Asthma Kid Care Go Bag, and it allows you to organize your asthma medicines and keep them ready so you're prepared for asthma symptoms whenever they happen. You can look at www.asthmakidcaregobag. That's asthma, KIDCAREGOBAG.com. You can follow me on Facebook, Instagram, and Twitter at Dr.JoiMD. Thanks for watching, and let's talk soon. Be well.